Now for a little bit more information on what makes a case and what makes a person a contact. This all has to do with whether or not you have tested positive for COVID-19 or if you have symptoms or if you have been in contact with someone who tested positive or has symptoms of COVID-19. So, for those who are cases, we'll get more into the definition of isolation versus quarantine. Cases are typically those who have COVID-19, meaning they have tested positive based on a laboratory test, or a medical provider has said that they meet the criteria as indicated by the Department of Public Health and the CDC that they also have COVID-19. A suspected or probable case is someone who has symptoms, meaning they are symptomatic, they have the cough, fever, shortness of breath, and potentially other symptoms, but they have not yet been tested for a laboratory test. Typically, if you are a suspected or probable case, you will likely order a COVID-19 test to follow up to make sure you actually have tested positive. For those who are contacts, these are those who have had contact with a case while they were infectious. Now, the infectious period can be 2 days, or this begins 2 days before the symptoms begin. And I'll show a little bit more of a graphic that explains this. And this can last up to 10 days after symptoms have began. Now, there are three primary types of contacts that are really important to keep in mind. The first is those who live with or are caring for somebody who is a case, the person who has tested positive or has symptoms of COVID-19. The second is having contact with a case's saliva. This can be someone coughs into a tissue and they drop the tissue on the floor and you pick the tissue up and throw it away. If you came in contact with the saliva, that is having a very close physical contact with somebody who is a case. The third type of contact, which will be what we're trying to prevent here on campus, are those who are within 6 feet for at least 15 minutes of someone who is a case, someone who has tested positive for COVID-19. Now, for the infectious period, let's say that you started developing symptoms on August 8th. 2 days prior to that would be when you started being infectious, meaning if you were in contact with a family member or household on the 6th and 7th, you would have been infectious and potentially infecting that person. And of course, the days after you are starting to feel these symptoms, you would be infectious for up to 10 days after that as well. Now, the difference between isolation and quarantine. So isolation we use to keep sick people separate from the healthy people. This means during the time that they are infectious, so the 2 days before the symptoms begin and 10 days after symptoms begin, these people need to stay away from others and self-isolate at home. After 10 days of the first signs of symptoms, if you've also had no fever in the past 24 hours, using no medications, you can come out of self-isolation. For those who are quarantined, this restricts movement and contact of healthy people who have been exposed, meaning if you went to class and you sat next to the person who tested positive for COVID-19, you would remain home from that class and not venture out for 14 days since the last time you had contact with whoever was infected.